So this is our last segment, and we just wanted to give some words of encouragement to not only those that have sickle cell, but also people like myself that are the caregivers. And so I'll pass it to my fiance here.
Oh shucks. um, if I had to give anybody advice on sickle cell, it's I'm gonna use my words wisely, so y'all give me just a second if I take a pause. I would say that you are a warrior within your own right. I would say to focus on the things that are the best parts of you. I feel like the type of heart that I have, the type of person that I am, I feel like those are the best parts of me. I feel like sickle cell is a part of who I am, but it's not who I am, if that makes sense. I have a job or a career, I should say. I have a wonderful, loving fiance. I have a support system behind me. My family, his family that rally around me. And so I know that a lot of people may not have those things. And so that's when you have to look for other things in your life that make you happy, that make you genuinely happy. Of course, definitely don't get down on yourself. I know that some days are harder than others. And I know that sickle cell is considered the invisible disease. So we don't wear it, but I feel like wear it, like people can physically see it, but I feel like we wear it well. We do a great job, okay? And so, there's tons of support out there, you know what I mean? And people to talk to, and I hope that this video shines a light on sickle cell and what it is and, the day-to-day things like that. But yeah, I am happy. I'm happy that we were able to sit down and really get into the nitty-gritty about, sickle cell and how it affects us on the day-to-day basis. And my prayer for others is that they will watch this and be informed, and if they have any questions, they will ask them respectfully, of course. And yeah, to those sickle cell warriors out there, it's September, it's our month. It's our month. So yeah, stay hydrated, y'all. Be great, and don't let nothing stop y'all, because we are what we are, and we wear our stripes very, very well. So I'm going to pass it over to the caregiver and let him say his words of encouragement.
So, as a caregiver, just try to make sure that you're, I guess, keeping the person you're taking care of encouraged, and try to make sure that they're thinking about things a little more positively. Just making sure that they're not so down on themselves, like she'll feel like she's a burden. Like, that's not the case. This is something that they can't help, you know what I mean? So you got to remember that, and you also got to know that in most cases their health is more important than most things that we have going on in our life. And so that's kind of what helps you push through, like getting an hour or two of sleep and then needing to take them to the hospital, or waking up in the middle of the night because she's in pain and you want to and she needs something to drink, for instance. Like, you obviously might not want to get up, but what's more important, you getting 10 more seconds of sleep or getting her some water? But just obviously, like, take care of your mental as well.
Yes.
Try to stay on top of that. And we actually go to premarital counseling, so that's helped a lot. But if you don't want to or feel like it's not necessary, definitely reach out to friends and family and talk to them just to vent a little bit, and also talk to the person you're taking care of and like letting them know, or letting each other know.
Right, check in.
Yeah, just checking in with each other about sickle cell in particular, but just anything really. And I think that's about it.
I think we did that.
But yeah, again, we definitely appreciate y'all watching our videos, and hopefully this sheds more light on sickle cell. It answers some questions, because we were just talking about this. Like, I know that there's like a little, you don't want to come off offensive by like asking certain questions, and it's all about everybody having respect for each other. Right. So like, if you know that somebody's genuinely trying to ask you about sickle cell, then if it's something that could be taken, that you could take offense to, just know that it's coming from a good place and that that's not really how they meant it. And vice versa, like, and part of it is a racial aspect, since sickle cell does mainly affect African American community. So like, I know some people who aren't of that community might feel like, I don't want to say something that could come off a certain way. Again, just, let whoever it is that you're talking to, like, know up front, like, I'm genuinely interested or concerned. If you feel like, what I mean, somebody has sickle cell, but you don't really know them enough to know a whole lot. Mm-hmm. But just, I'm genuinely concerned. I know you mentioned you had sickle cell, like, what exactly is going on? How can I help? You know what I mean? Just take your time with your approach on both sides. And I feel like the conversation will go pretty well.
And feel free to ask me, because, ask us, because, that's what the whole purpose of us making this video. We don't know how far this is going to go, but we definitely wanted to just sit down and give our perspective on it. And so anybody that has any questions, or we tried to make it in a way where it wouldn't be like too much information all at once, but just enough to give you a sense of, the overall gist of it. But if you all have any type of follow-up questions as to, what we've said or things like that, please feel free, to comment and ask those, so we can answer those in the best of our, ability, whether it be, from the person who has a sickle cell or the person that is the caregiver of the person with the sickle cell. We are definitely open to discussion regarding this topic.
And also, those who have sickle cell and are caregivers, feel free to comment and talk about your experiences, or feel free to clip our video if you wanted to, elaborate on some of the stuff we've talked about.
Absolutely.
Yeah, we definitely want to get a conversation going. And yeah, I think that's
it. And as I mentioned, it's September, so it is Sickle Cell Month. So I don't know when this video is going to come out, because like editing and things like that, but I definitely just want to make you all aware that September is Sickle Cell Month. So, if you got a sickle cell warrior in your life, go ahead and, give them a pat on the back. Let them know that you're there for them. So yeah, thank you all for listening and watching.
Thank you.